Hi, my name is Liz Kahane, and I'm here today to talk to you about paid family leave policies and population health as part of HCA 701 at UNLV. During today's discussion, I'm going to start off with an overview of paid family leave in the United States, discuss potential policies and agencies involved in implementation. We're going to talk about public health, advantages and disadvantages, and then also paid family leave policy and the impact on the healthcare system. The goal of today's presentation is to discuss paid family leave policies, the impact on health, and why paid family leave would be beneficial to U.S. population health. So to start off today, we're going to talk about what is paid family leave. Paid family leave gives workers the opportunity to take time away from work to care for either new children or an unwell family member. Traditionally thought of as leave for new mothers, paid family leave may include leave for men or women in the workforce. So to talk a little bit about paid family leave in the U.S., the United States is actually the only country out of the 35 OECD countries that does not provide leave for new mothers. And it's one of 8 countries not providing leave for new fathers. International policies vary based on length of leave and other factors, and are also impacted by other policies within countries such as free childcare. Here in the United States, we do have the Family Medical Leave Act, FMLA, and this is used for family leave in the United States sometimes. There are strict restrictions on the size of the employer and the length of employee tenure for FMLA to apply, but it does protect the position, though it's unpaid. It is highly restrictive, so not everyone has access to FMLA. There's also uneven distribution of paid family leave across different income levels. And there's also variance by employer and state policies in the United States. In fact, only 13% of the workforce receives paid family leave through their employers currently. Paid family leave does vary based on state legislation, and depending on what state you're in, that means that you'll have a different access to paid family leave. For example, the states listed on here in yellow are states that have paid family leave programs in place. Those in turquoise have bills introduced, and those in white do not have a state-based paid family leave policy. So these policies do vary by state, and 5 states, along with Puerto Rico, have state disability, which does provide some income to expecting and new mothers. This disability, however, is very limited and restricted on when it can be used. California was the first state in the United States to implement paid family leave policy back in 2004. Their policy allows for 6 weeks of leave, which is funded through an employee payroll tax, and it can be used by either new parents, either men or women, or to care for an unwell family member. The way that it works is that the person taking the leave receives 55% of their pay, which is capped at a max weekly benefit, and there's job protection if there's also FMLA qualification. In California, this policy has shown to reduce some inequalities in leave, and it has also shown a positive impact on labor market trajectories as well as child well-being. At the federal level, we have FMLA, which we discussed earlier, which is run by the Department of Labor. There's also been a proposal called the Family and Medical Insurance Leave Act, the Family Act, and this would be funded through payroll contributions and provide up to 12 weeks of paid family leave for all U.S. eligible workers. This program would be implemented through the Social Security Administration. There was also a proposal through President Trump's budget to fund paid family leave through unemployment insurance, and that would be administered through the Department of Labor, which oversees unemployment insurance. So there are a number of public health implications related to paid family leave. I'm going to start off by sharing some related to the impact for children. There are improved developmental outcomes, better access to doctor's appointments, and increased parental care, lower mortality up to 5 years of life, a 47% decrease in odds of rehospitalization for infants, reduction in low birth weight babies, and preterm births. On the parental side, there are also extensive public health benefits for parents who are able to utilize paid family leave. They're better able to keep their jobs and retain income to provide for their children. There are reductions in stress, increases in exercise, better health for parents both mentally and physically, a decrease in the odds of women being rehospitalized, improved mental health, and maternal life satisfaction, in addition to better interactions between mothers and children. Overall, there's better maternal and child health when paid family leave policies are implemented. In terms of advantages of paid family leave policy, one huge advantage is what we were just discussing earlier, the better health outcomes for parents and children. And there's a particular advantage for those from diverse backgrounds as well as to single mothers, according to Aiken. It also can reduce socioeconomic disparities of family leave use and health benefits. There's higher employment and work continuity for mothers, and a positive impact on career trajectories for women with children and their lifetime earnings. There are perceived disadvantages of paid family leave as well. There are concerns cited over decreases in women's pay, but actually there are studies indicating that women with paid leave work increased hours. There's also the difficulty of having laws passed during a polarized time in our government, and so that could definitely be perceived as a disadvantage as well. In order to implement paid family leave policy, we would need to use laws, rules and regulations, and judicial decisions. We would need to pass laws that create paid family leave policies, either at the state level, such as in California, or at the federal level. We would then need to use rules and regulations set up during the time of legislation, but that could be amended so that we could support making changes based on what was working well and what wasn't working within the policies. We would also need to use judicial decisions. There's likely to be cases brought against a new state or federal policy, so judicial decisions would need to be used to help cement or make changes to the law. Related to delivery, financing, quality, and accessibility of health care, paid family leave increases access to and accessibility of care for women since they will have compensated time to care for themselves and their infants after childbirth. There's also possible better long-term financial outlook as preventative measures such as vaccinations are better utilized, decreasing potential costly health problems down the road. Additionally, cost savings are possible with a decrease in rehospitalizations for both mothers and infants. In terms of support and objections, there are some groups that may come down on both sides of this argument. For example, those supporting may include groups that support women and family-friendly policies. On the objection side, there may be organizations such as chambers of commerce or business organizations which may worry that paid family leave will impose an undue burden on employers, particularly small businesses. However, in California, cost has actually shifted to the employee rather than the employer given their payroll tax structure. There may also be opposition from groups supporting small government and low taxes. According to Zhao in 2018, there is empirical evidence of significant associations between paid maternity leave and positive indicators for maternal and infant health in the United States. Throughout this presentation, we discussed many of the positive benefits of paid family leave on both mothers and children. Because of these benefits, I do believe that paid family leave policy is a good policy for the United States. We do need additional research to better understand the impact of paid family leave policy, particularly on parents, the population health as it relates to those who are caring for an unwell family member, effects on employers, and also what pieces of paid family leave policy make the most difference in health. Here are my sources. Thank you very much for taking the time to view my presentation today.